So today we're going to prepare tooth number 18 for a gold onlay. One of the reasons that we've chosen 18 is to illustrate how preparing with clearance in mind rather than just reduction can help to both conserve tooth structure and improve the occlusion on the tooth that you're restoring. Tooth number 18 on this particular typodont is shifted about a half a cusp to the distal, and so it doesn't have a good cusp-fossa relationship. And in the process of preparing this onlay, we're going to try to improve that along the way. So let's go ahead and get started. We'll, as we always do, we'll start with a 1557 carbide. We'll do guide cuts. We'll connect those guide cuts. And the other thing we're going to do, we're going to simulate that something has been, when I say something, a restoration has been in that tooth, because typically when we do gold onlays, we're doing them in a situation where there is a failing existing class 2 restoration of some kind, an amalgam, a composite resin. And so we'll cut an isthmus, we'll do a mesial and distal box, and then we'll proceed with our occlusal reduction from there. And we may have to refine that isthmus and that box a little bit along the way. These onlay preparations are very conservative. They basically, you take the occlusal surface down for the thickness of the gold that you need, and then you refine everything internally for your resistance and retention form, because it's all based upon what's going on underneath and inside. It's the sides of your isthmus. It's the walls of your box forms that are going to give you the resistance and retention that you need to hold that restoration in place. So we'll start with preparing an isthmus and a mesial and distal box form, just to simulate that there was an existing restoration there that we removed. This is likely going to be about 1.5 millimeters. The flutes on this burr are 4 millimeters, so in length. So we'll not quite go the full length of that. The more you can maintain an extension into both the lingual and the buccal groove, and make those very definite, the better resistance and retention form you get. You actually improve that by that little dovetail-like extension. We're approaching that distal box area. Certainly on a typodont, we want to be careful not to run out of structure and get too close to the hard gingiva, which are very unforgiving. So we'll keep everything a little bit high, a little bit under prepared at this point. Many students will ask, well, how wide do we make these box forms? They're so used to being very conservative, and for good reason. But I remind them that usually they're replacing something that was there that was at least wide enough to break the contacts when it was placed. And so don't be too conservative. Go ahead and open that box form up a little bit. So again, it's rough at this point. We're just kind of establishing that there was something here. And now it's time to work on the occlusion. So again, with this particular typodont, the cusp-fossa relationship is just a half a step off. And so the triangular ridges actually line up almost cusp tip to cusp tip. So we'll place our guide cuts accordingly. There would be a guide cut about right there. That's opposite the triangular ridge of the mesial buccal cusp of tooth number 15, and there's another one right about there. And so that's where we'll stay. Now, keeping in mind, on this preparation, the functional cusp clearance is 1.5 to 2 millimeters, and then the non-functional cusp on the lingual aspect will be 1 to 1.5, so it's just a little bit less on those non-functional cusps. We want to keep our guide cuts just a little short of that, so it gives us room to refine that occlusal reduction that we're working on. So let's check and see if those two guide cuts that I placed are in a reasonable spot, and they are. The one towards the mesial is a little too mesial, so I'll move it back. I'll adjust it back just a little bit. And then I'm going to go ahead and do the guide cuts for the rest of the occlusal reduction, just based upon the anatomy of the tooth. Again, we'll refine that based upon clearance in just a few minutes. So there's the lingual groove. We're going to do this triangular ridge right here at the distal lingual cusp. And then this triangular ridge at the mesial lingual cusp. And then we'll work on the functional cusp right there. And there's not going to be, this buccal groove aspect will actually be a high point because of that cusp-fossa relationship we talked about. So I'm going to leave that alone for a minute. Normally, when you're doing your guide cuts, you'd put a guide cut right there. So that's about all you need in the way of guide cuts at this point. You could put guide cuts at the extreme marginal ridge, the extreme mesial, extreme distal as well. In fact, we can go ahead and add that, keeping in mind that these areas may be up just a little bit, or occlusal. So that's all of the guide cuts. And now we'll go ahead and connect those. So we'll start over here on the non-functional cusp. And all of this with the 1557 is again, we're just kind of roughing it out. It's a nice burr to use at this stage because it cuts very cool. Normally, we'd be using lots of water if this was a clinical situation. But on Typodont teeth, that can get a little messy, and it's also hard to see. I'm going to extend this burr just a little bit, if it'll stay in the chuck, to do the functional cusp bevel. So basically, as with any full coverage restoration, we've simply done our occlusal reduction along the functional cusp bevel, and the non-functional cusp. So let's see how it's looking now as we're trying to kind of true up that occlusal, that cusp-fossa relationship. And I can tell as I'm looking from the side that it's improved, but I've got a little more work to do, and I'm basically looking at what areas are still close in my mind's eye, and it's still close right in here, right there a little bit. So we'll refine the clearance there, and we've got a little bit more to do. And it's starting to take shape there with our clearance. Again, at this stage, it's just rough. You want to stay back a little bit from your target of 1.5 to 2. But we can take the 1557 out now, and let's go ahead and refine our occlusal reduction. And you can do that with any of the tapered diamonds. I've got a 6878K 018 diamond in right now, so we'll stay out here where we can see really well on the functional cusp bevel. And once we have the functional cusp bevel dialed in, and I'm going to use this red stick. This stick is 1.5 millimeters in diameter. So if I want to be in that range of 1.5 to 2, I want this red stick to just fit and maybe wiggle a little bit. So let's see how we're doing on that. I'm going to first look with my mouth mirror, and I can tell that we're getting close. In fact, it's real close. So it's a little tight right there towards the mesial, just fits, and a little bit towards the distal there too. So there's a couple of places that we need to refine just a little bit right there. There's a lot of opening and closing at this stage with our patient, helping us to check clearance. And so that's a mesial facing incline. And so I'm just doing a lot of checking and then adjusting, and checking and adjusting. And a little more right here. Now let's check with our measuring stick and just see that we're at least 1.5, if this will fit, along the functional cusp bevel, and it does, and it's got a little bit of space. So that establishes the clearance along the functional cusp bevel. Now, we want to work lingually, and so now we'll focus on the functional cusp reduction along these inclines. So these are the lingual facing inclines of the buccal cusps. And the way to do that is to have the patient close. We'll bring this in from the mesial. So I want to be able to see. I've got to hold the patient closed here as well. And I'm going to try to work over the cusp tip, but I can't. I can tell it's already, and I would expect that. I haven't refined anything along the functional cusp, but that's coming from the mesial. Use the other end to come from the distal, and still tight there. So all along the functional cusp reduction, which we would expect, we'll have to take that down a little bit. And then we just go back and check and see if this red stick will now start to go over that cusp tip and down along the functional cusp. And it's starting to now. It's a little bit tight toward the distal still, but we're making progress. We'll come from the mesial now and check and see, and that's still a little bit tight too. It needs to be able to fit in there and wiggle a little bit, and it's not doing either at this point. One of the things you'll find with this preparation is that you might completely obliterate the isthmus that you placed, which is fine. We were just placing that to simulate that there was an existing restoration, and we'll refine it in just a minute after we've established our occlusal clearance. It's always easiest to work your way inward or work your way lingually because you gain access that way. And now it's starting to fit a little bit better along the mesial aspect. Let's see how the distal does. Little tight, so we could reduce a little bit more, and I'm going to do that, and then I'm going to start on the non-functional cusp. So we'll take a little bit more off based upon that last check. You definitely don't want to be under-reduced on these. Gold does wear over time, and that's one of the things that will cause it to wear out, is it will perforate after many years of use. So now let's move over to the non-functional cusp. We'll try to refine that. A lot of this also is based upon how does this look with respect to my adjacent tooth? Does it look like I'm reducing a reasonable amount? If the occlusal reduction looks like it's still up in the neighborhood of your adjacent tooth, obviously you haven't given yourself enough clearance. And you want to look at it with respect to the occlusal reduction that you've established on the rest of your preparation. So let's see now how we do going all the way across. We'll start at the distal, keeping in mind that this straight measuring stick, it may not easily fit. Oftentimes if you're reduced or clear to the right amount, you'll have to wiggle and work it through a little bit to get it to move on through to the other side. We're still a little under-reduced right toward the mesial aspect here, where that great big functional cusp from number 15, the mesiolingual cusp, is. So we want to hollow this out a little bit more, but we're getting close now. And based upon that last measurement, plus what I'm seeing with respect to this adjacent tooth, I'm guessing that we're about in the neighborhood now of where we want to be. So I'm just going to refine my occlusal reduction a little bit here, trying to maintain the anatomy, although we've changed it a little bit because of that cusp-fossa relationship. And that's about it. Now we have almost eliminated our isthmus, and that's okay. We're going to go back now and refine it. Now for this preparation, clinically, normally you'd still have plenty of isthmus, plenty of box forms, and you'd use those now to create internal retention with your preparation. And so what we're going to do now is simulate doing that. For this preparation, we want to have the isthmus be an additional 0.5 to 1.5 millimeters pulpal or apical to the planes of occlusal reduction. The reason there's such a big range there is because the occlusal reduction is so variable in places. It's more occlusal in some places and it's more pulpal in others. So we do want to see buccal and lingual walls on the isthmus, and we want to see a nice extension into the lingual groove and into the buccal groove, because again, those will add to the resistance and retention form of the preparation. We want to use to our advantage the taper that's built into this KR diamond. It's a flat-ended diamond. It's the exact same shape as a 172 carbide. I prefer the diamond because it doesn't dig in. It's a little smoother cutting, and it's less likely that you'll create gouges in your pulpal floor and in the box forms. You can use either burr, but we're going to use the diamond for this, and we're just going to drop that isthmus a little bit, and we're going to pay particular attention to maintain that 6 to 10 degree taper. It's real easy to have the walls of that isthmus get undercut if we're not careful, and so you really need to kind of accentuate leaning the burr to the lingual when you're working on the lingual aspect of the isthmus, and leaning the burr a little bit to the buccal when you're on the buccal aspect. Otherwise, it's real easy to get an undercut. So let's refine this. Our isthmus is about 1/2 to 1/4 deep right now. It's very, very shallow, and that's okay. So we're just going to drop it down a little bit. It's important that you keep with the axis of the tooth here. So I'm lining this burr up with the overall axis of these teeth, so I don't have my internal retentive features off axis. They need to be fairly well lined up with your tooth. So I've kind of smoothed out this pulpal floor. I'm working on smoothing it. Just using the high speed and stall out, it's very easy to do that, both clinically and with these Typodont teeth. And we'll see how it's looking from the occlusal. That looks good. And now I'm going to refine the wall. So I'm going to refine the lingual wall of that isthmus. So I'm going to lean lingual a little bit with my handpiece. And then I'm going to do the same with the buccal. We're going to lean to the buccal. And let's see what that looks like here. Let's check to see that we're creating a little taper in there, and it looks like we are. We've got a relatively smooth pulpal floor. Now we're going to drop those boxes so that they are 1/2 to 1 millimeter gingival to the level of the pulpal floor, but yet we need to keep them supragingival enough that we can add a bevel around those boxes and still be at least 1/2 millimeter supragingival in the end. So I'm going to aim for about 1 millimeter to 1.5 millimeters supragingival with the gingival floor of my boxes when I'm all done with these. So we'll use this same diamond. I'm going to work at the mesial here. Right now I'm a good 2, almost 3 millimeters supragingival probably. So we're going to drop this. Remember the axial wall of these boxes has to taper. It has to follow the outline of the cavo surface of the tooth, so it has a slight curvature to it, and it's going to taper toward the other box. You can develop an undercut between these two box forms if you're not careful. So again, as you go to the buccal and lingual, you need to kind of accentuate that, or you'll develop an undercut between the buccal and lingual aspect of your boxes. Now these boxes they're going to be about 1.3 millimeters deep. Let's go ahead and clean that up a little bit. So axially 1.3, which is the diameter of the tip of this burr. And that one looks pretty good. I think we're in the right neighborhood. We're going to work on the distal now. And remember these two axial walls. So the axial wall of the mesial box has to taper toward the axial wall of the distal box. So let's work on the distal box. I'll tip my handpiece mesially, and then we'll start to drop that a little bit. And I'm going to widen the box a little bit. Again, there likely was a restoration there that was fairly wide anyway. So So I'm accentuating all of the taper. All these walls have to taper away from one another, both in the box forms and in the isthmus. We'll just smooth that out like that, and use just the diameter of this burr as a guide there on our depth. So I'm a little shallow toward the buckle, so let's bring that in just a little bit. Again, I'm leaning this burr to the mesial and to the buckle as I create that wall. And we'll refine the floor of this just a little bit. Making sure I have a flare. Everything's flaring away. All these walls are flaring away from one another. And we're there. So we've got our distal box, our mesial box established. I'm going to just smooth these transitions from the isthmus to the box form a little bit so they're not so abrupt. So I'm just going to take the isthmus and just blend it into that box form a little bit on both the buccal and lingual. And I think we've about got that. So our occlusal reduction is complete. The refinement of the isthmus and the box forms are complete, and by doing so, we've created now most of the resistance and retention form for this preparation. The last little bit of resistance and retention will come from the bevels, including the bevels around the box. So we're going to move to that. The best burr I've found for placing these bevels is this fined flame diamond. You know it's fine because of that red ring, at least with Brasseler. This is really a nice instrument for creating the bevel around the box. Now at this point, we have lots of leftover tooth structure that's kind of hanging out around these boxes. These bevels around both boxes actually have to taper towards each other when we're all done. So you're going to cut a fair amount of tooth structure off as you go occlusally and make this cut. So if you can take the tip of your diamond and lay it against, get it lined up properly so that you're not going to nick the adjacent tooth. You want to miss that. So this burr is going to set, I'm going to set it against the gingival floor of the box, that cavo surface, the gingival floor cavo surface exit, because I want a bevel there. I want a gingival bevel around that. So I'm going to lay it against it, and then I'm just going to start, I'm going to get it all lined up properly, and I'm going to give it a little bit of gas there to just start to sand that bevel down at the gingival aspect. Your bevel is to be about 0.5 to 1 millimeter wide. Now, at this point, I'm going back and forth, and now I'm going to gun it and exit to the lingual and cut off that big bunch of tooth structure. I'm going to the buccal now, keeping it at the same angle. And now I'm just going to refine that cut. So I'm refining my gingival bevel and the transition into the buccal and lingual bevels. If you don't hit the rheostat and really punch it as you break out to the buccal and lingual, it'll often push you into the adjacent tooth. So the mesial bevel is placed. I'll check it for smoothness. It looks good. And now I'm going to place the bevel around the distal box. And remember, these two bevels will have a slight taper towards one another. And if you do that properly, you can actually improve your resistance and retention form. It's real easy to under-reduce this bevel at the corners of the boxes. So make sure that you keep that bevel at least a ½ millimeter in width as you transition from the gingival to the buccal and lingual aspects of these. So, the mesial and distal bevels have been placed. And now the final part of this preparation is simply making a 360-degree bevel around this preparation. You have the mesial and distal done, and so on the buccal, we'll just refine the edge of our occlusal reduction, and that will become the buccal bevel. I want to make sure that it's a smooth transition. And so we'll just follow along that occlusal reduction. If I wanted to add resistance and retention to this preparation, I would put a shoulder on the buccal aspect. We don't need to do that, but you could if you wanted to add resistance and retention. If you see any sharp corners left, go ahead and just smooth those off a little bit. I saw one there. And now we'll do the same thing on the lingual. We'll create a bevel about a ½ to 1 millimeter wide, and I'm just adding that. I can do that at a fairly steep angle. The main thing on this is just that it's a nice continuous smooth bevel, smooth margin all the way around your preparation. And that looks good. Again, we'll try to get rid of anything sharp. It's also nice to put, to bevel your axial pulpal line angle between your box forms and your isthmus. You don't want a real sharp angle there. The metal will flow better when it comes time to cast. And that, let's go ahead and just clean that off a little bit. That is our onlay preparation, and we've tried to dress up and improve our occlusal relationship a little bit in the process.